Today we're going to be talking about the vasculitides. Now, the vasculitides are a very broad spectrum of illnesses, and they're often made quite confusing by the textbooks. However, for year 3 and also for year 5 and year 6 actually, the vasculitides, there's not much that needs to be known about them. And what I'm going to do today is give you a brief overview of how we can differentiate them. So what are the vasculitides? Basically, they all involve the inflammation of blood vessels, and the etiology of how this comes about is extremely confusing and is not very well known. But because it's a chronic inflammatory condition, the patients will often get symptoms which are quite generic and systemic. So these can include fevers, myalgia, sometimes arthritis, tiredness, loss of appetite, etc., etc. But sometimes they have quite specific symptoms, and these are the ones that we're going to talk about the most in this podcast. Now, the easiest way to differentiate the different types of vasculitides is to divide them depending on the size of vessel that is primarily affected. So we can divide that into those that affect the large vessels, those that affect the medium vessels, and those that affect the small-sized vessels. So there are two major arthritis that affect the large-sized vessels, and that is temporal arthritis, otherwise known as giant cell arthritis, and Takayasu's disease. So temporal arthritis, or otherwise known as giant cell arthritis, primarily affects the carotids and the branches that come off of it. And so we can see here it can affect the temporal arteries, the ophthalmic arteries, the facial artery, or the occipital arteries. It generally occurs in women in a ratio of 2:1, and it almost exclusively affects patients who are over the age of 50. Therefore, any patient who comes in with the symptoms of temporal arthritis and is over 50, you need to have a relatively high index of suspicion that it may be temporal arthritis. So what are the major symptoms? There are two major ones that you need to know about. The first one is that they will present with a frontal headache that is persistent. And this can also be accompanied by a tenderness over the scalp region. And often the patient will only realize this as they comb their hair. Now, because the branches of the internal carotid supply a huge number of parts which are very important in the face, including the eyes, one of the biggest risks of temporal arthritis is that of blindness. So if a patient comes in with a headache and then has a transient loss of vision in one eye, your alarm bells need to start ringing, and the patient will need to be commenced on IV steroids. So that's temporal arthritis. We're now going to talk about the second one, which is called Takayasu's disease. And this disease generally affects the large blood vessels that originate below the carotid arteries. So this would be the aorta and the vessels that come off of it. It generally affects Asian women, so those who are Chinese and Japanese, and this can be remembered because Takayasu's is a Japanese physician who discovered it, and therefore it's primarily found in the Japanese population. And contrary to temporal arthritis, it affects patients who are relatively young, so in their 20s and their 30s. Now, what happens in Takayasu's is that we get inflammation of the blood vessels coming off the aorta and even the aorta itself, and this can actually lead to stenosis of these blood vessels. So here we can actually see one of the blood vessels coming off the aorta, the brachiocephalic, has actually been stenosed. Now, you would think that this would cause major symptoms in the patient, but because collaterals are able to form, the patient often doesn't have any symptoms at all, apart from the usual systemic ones of tiredness, myalgia, and sometimes a fever. So often these patients are actually diagnosed incidentally when they have their blood pressure measured in both arms, and there's a marked difference between them. So that is the two large vessel vasculitides. We're now going to talk about the vasculitides that affect the medium-sized vessels. And there are basically only two that you need to know about. The first one is called polyarthritis nodosum, and then the second one is called Kawasaki's. So polyarthritis nodosum is a widespread vasculitis that affects multiple organ systems. And again, the symptoms are often very non-specific because it doesn't affect organs too much until quite late on in the disease. But the classical area that it affects are the vessels supplying and within the kidney. And so what can actually happen is that the patient may present for the first time with signs of some form of chronic renal failure. And the reason why it gets its name is because when we take a look at the blood vessels, there's this inflammatory process that goes on for a long time, which actually leads to necrosis of the blood vessels, which leads to these characteristic nodules, as shown in the picture on the right, and hence the name polyarteritis nodosum. The second medium-sized vasculitis is called Kawasaki's disease, and this is actually increasing in incidence, and it affects children almost exclusively. And again, it has a higher prevalence within the Oriental community, particularly the Japanese population. Again, this can be remembered because Kawasaki is a Japanese physician. Now, the etiology is not well known, however, it is thought to be secondary to some form of viral infection, although there is a huge debate about this. Now, Kawasaki's can mimic a huge number of diseases, the most common one being scarlet fever. However, there has been a new diagnostic criteria used to diagnose it, because it's very important to diagnose it, as we will discuss later. So the criteria requires the patient to have fever for more than 5 days, and then 4 out of the following characteristics. So the first one is conjunctivitis. Second is to have changes to the patient's lips or oral cavities, so the mouth and the lips can become dry or cracked. The lips can become swollen, or the tongue can become strawberry-coloured in appearance. The third characteristic is cervical lymphadenopathy. The fourth is erythema and desquamation, particularly of the palms and the soles, and literally the skin on these areas will start to peel on day 4 or 5 of the disease. And then finally, the patient can also get an erythematous rash anywhere on the body. Now, the reason why it's very important to diagnose Kawasaki's disease is because of the medium-sized vessels that it involves. And the most important one of these are the coronary arteries. And the biggest complication that can occur is a coronary aneurysm. And before this was known, the vast majority of patients who develop Kawasaki's disease would actually go on to die from myocardial infarcts because of the disturbance in blood flow around the coronary artery. Now, luckily, we've been able to realize that this is one of the complications, and so these patients are able to be put onto aspirin and other regimes if required to try and stop Kawasaki's disease. So we talked about the medium-sized vessels, vasculitides. Now we're going to talk about the last one, which is the small vessel vasculitides. And there are 3 major ones that need to be known about. The first one is called Wegener's granulomatosis. The second is Churg-Strauss syndrome. And the third one is microscopic polyangiitis. Now, just a note about the small vessel vasculitides. They share 2 major characteristics. The first one being that obviously they involve the inflammation of the small blood vessels in the body, but also they share a relatively strange phenomenon in that the patients sometimes have an antibody which is called ANCA, or anti-neutrophil cytoplasmic antibody. And there are 2 major forms of this antibody. One is called C-ANCA and the other one is called P-ANCA. And the different types of small vessel vasculitides will have different types of this antibody. So let's go through these now. So the first one is Wegener's granulomatosis, and this vasculitides generally affects the midline structures. So shown in the picture, starting from head to toe, the nose can be affected and the patient can present with nosebleeds, pain, and sometimes have this rare condition called saddle nose appearance. And in this, the cartilage within the nasal bridge will actually start to become destroyed, leading to this saddle nose appearance. If we move our way down in the lungs, the patient will actually start to form nodules within the lung and can also become start to develop hemoptysis as well, and sometimes get fibrosis within the lungs. And finally, as we work our way further down, we get to the kidneys, and these patients can sometimes present with glomerulonephritis. Now, we talked about the anchor antibodies, and vagus has a close association with the C anchor form of anchor antibody. Now, it doesn't mean that all patients with vagus will have C anchor, nor does it mean if a patient has C anchor they will have vagus. However, there does appear to be an association between C anchor and vagus. The next disease is called Churg-Strauss, and this is often found in association with a late onset asthma, and these patients will have a raised eosinophil count. Now, these patients characteristically will first of all develop some kind of allergic reaction to some unknown antigens. They get the rhinitis, they get the wheezing, etc. This will then progress onto some form of asthma, affecting obviously the lung primarily, and then the disease will start to spread to other areas. So the gut can be involved, the kidneys can be involved, and finally the nerves can also be involved. And this is generally the last stage of the disease, in that the patient will start to get painful extremities due to nerve damage. Now, Churg-Strauss syndrome is found in association with both types of anchor antibody. So both C anchor and P anchor have both been associated with this disease. Now, the last type of small vessel vasculitides is called microscopic polyangiitis, and this can affect a huge number of organs and organ systems. And the most common ones are shown here in the diagram. So the neurological symptoms are first, so we can get individual nerve lesions in multiple places, otherwise known as mononeuritis multiplex. The lungs can also be involved, and this will give rise to hemoptysis. The kidneys can also become affected, which will lead to renal failure, and these patients can also develop a rash on their skin. These four characteristics are the most common ones, but the other systems shown in this diagram can also be affected. Now, contrary to vagus, microscopic polyangiitis generally has an association with P anchor, but again, it is extremely important to realize that P anchor does not necessarily mean that the patient has microscopic polyangiitis, nor does not having P anchor mean the patient doesn't have microscopic polyangiitis. So that is the vasculitides. We've divided them into three major characteristics. The first one being those that affect the large vessels, that being temporal arteritis and Takayasu's disease. Those that affect primarily the medium-sized vessels, which are polyarteritis nodosum, Kawasaki's disease, and finally those that affect primarily the small blood vessels, which is vagus, Churg-Strauss, and microscopic polyangiitis. So thank you very much for listening, and I hope that you've learned something today.